Oh, 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 oh God. Oh, yes, 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 yes.
So we're going to start with anatomy because this is the big lesson. I don't know how many people understand or know that the clitoris is actually the same as the penis in embryology. So if you can see where the glans clitoris is, that's actually the same as the, what is called, funny enough, the corona or the head or the glans of the penis, the tip. Where the clitoral shaft is the same as the shaft of the penis. So that's where our sensitivity is, both in the glans and then the shaft. And then where you can see the corpus cavernosum, which are those dark rose color, that goes around the clitoral complex. And that comprises the clitoral hood. So all of that is super sensitive, as we know. The bulb of the vestibule goes under, and that attaches to where the vaginal orifice or opening is. So often I am asked, what is the G-spot? Is it a thing? Do men know where it is? Blah, 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 blah. The G-spot was actually coined by a German gynecologist, Grafenberg, and is an erogenous area of the vagina that when it's stimulated, it leads to more sexual arousal, powerful orgasms, and potential, and we will focus on this a little bit throughout, female ejaculation, because that is a thing, and it's not everybody, but it is a thing. So this is a great slide. I love this slide because people don't always know what is normal and what isn't normal. And I'm asked all the time, is it normal to only have an orgasm with clitoral stimulation versus vaginal stimulation? You can have an orgasm in a lot of different ways. And I think somebody sent in a question that referenced that. So obviously we all know, and probably is most common, having clitoral stimulation causing orgasm. But also you can have an orgasm through vaginal stimulation, and that's felt deeper in the body. It's felt with penetration of the vagina, and often the vaginal walls will pulsate. It is also possible to have orgasm and feel it in the anus. It causes an intense need to urinate, and it often is associated with many contractions. So it isn't always a result of anal intercourse or anal stimulation, but it can happen where you feel it in the anus. And then there's the good old combination where you just can feel everywhere. And this is particularly the G-spot. So the clitoris and the G-spot are stimulated at the same time and is more of what I like to call the movie style orgasm or the adult film orgasm. So it's kind of a convulsing effect and can lead to female ejaculation. And then there's those zones that aren't associated necessarily with your genitalia. So some people like their ears or their neck or their nipples or their elbows or their knees. It is possible to have an orgasm when you have those erogenous areas stimulated. So I gotta go over the squirting myth. It's not a myth. It doesn't happen for everyone. And truth is, you are normal if you don't, and you're normal if you do. But a lot of people ask like where that fluid comes from. And I wanted people to understand where it comes from. That comes from the Skene's glands. It's kind of like the female prostate. It surrounds the vagina, and where they're located is the anterior or the front. So when I say anterior, that's the front of me, of the vaginal wall. So through G-spot stimulation, we can ejaculate. What is ejaculate? It is actually a mixture of urine, but it doesn't smell like urine, and the Skene's gland ejaculate. It is kind of a creamy white, and when a lot of people will ask, like, can I teach myself? Is it normal? If I don't, whatnot? The best advice I have for you is get to know your own body, what works for you. Practice is the best thing that you can do. Self-stimulation, where you know what works for you, you can then teach a partner. So obviously there's no harm with a partner, but people usually feel more comfortable with themselves, understanding what works for them before teaching a partner. And a partner, when we talk about the G-spot, may have a little bit more luck reaching it because it's rather high up in the vagina usually. Toys, I think we're going to cover that a little bit because we did have a few questions about toys and recommendations, but obviously if you're trying to access something higher up, you need a longer toy, one of those wands that curve inward, not just clitoral stimulation. The key is to enjoy this. This is not a job. This is not a chore. Relax, enjoy the experience, try different things, and learn what works for you. So I'm going to focus a little bit on the Oshot. A lot of people ask what I can do to help their scenario. If we go back to our initial questionnaire, if you're in that 10 to 20 range of something's not working, something's working, there are things that we can do to improve sensitivity. The Oshot is what I do at Elite Aesthetics. It improves orgasm with sensitivity. It improves lubrication. It improves stress urinary incontinence by reducing it. It improves the issues of dryness and lubrication, improves overall sensitivity, and it leads to a better sexual experience overall. What is an Oshot? I'm injecting something called PRP, which is platelet-rich plasma. Plasma is a component of your blood. It contains special factors that are proteins that help with your blood to clot, but also help support cell growth. So it does help improve the vasculature of the actual area. More blood flow, same as with Viagra. More blood flow, better reaction, better sensitivity. The idea of injecting platelet-rich plasma into these damaged tissues helps the stimulation of new tissue and new body growth, new healthier cell growth. So I'm going to walk you through an Oshot. It's super easy. You fill out your female sexual index when you walk through the office, which now is electronic thanks to COVID, so no paperwork anymore at Elite. And upon arrival, you come into the room, you change from your waist down. I place a topical, it's just a cream, numbing cream, internally and externally. Externally is on the clitoris, internally is on the interior wall of the vagina. You sit there for 30 minutes. During that 30 minutes, I will draw 2 small tubes of blood, and those are spun in the room. And that is for safety. There's never a risk that your blood is going to be confused with anyone else's blood. There is no risk. It is a 5-minute centrifuge that's in the room with you. And then you can see what the blood looks like. The yellow is your plasma. The white is the buffy coat, which is where all the goodies are, where the platelets are. And the red is actually disposed of. That's your red blood cells. So once I remove the platelets, I then inject with 2 injections. And the very first question I will get is, does it hurt? I promise it doesn't hurt. You are so numb that you don't know what it feels like when you pee after, because that cream takes about an hour to wear off. So no, I don't want you to feel it at all. So that's injected and off you go. There's no downtime, and you go and try it out and see how it works for you. So common questions before I hit the road with your questions is, does it hurt? My answer is hell no. It's my job to make it not hurt. I want you to be really comfortable. When does it take effect? Everyone's different. I'd say 75% of people takes effect immediately, but it can take up to about 90 days for new collagen to form and new blood flow. So you should see an improvement over that 3 months. Question, how long does it last? About a year, but again, this is very subjective. So did your relationship change? Do you have a new partner? If it's the same partner and you're having sex once a week for the whole year, most people will say it's a year. And how much does it cost? Finally, it's $12.95. So just to back this up with what I have found in my office, I do these all day, every day. I love them. Everyone's super happy. I have a lot of experience, both as a gynecologist, but also doing PRP for years now. About a 95% satisfaction rate. And I think that has a lot to do with the patients I don't do. So if you come to me and you have, let's say, had a vaginal birth injury and you've never had an orgasm in your life and you want the Oshot to help you have one, it's not for you. It's not going to work. Versus improving what's already having sensitivity issues. So I pick and choose my patient population very carefully. Out of those 95% success rates, I have about 80% that have already come back for their second and third over the last 3 years. You can look at our website. We have great reviews. And I have had 2 Oshots, one each year. So I'm a true believer.
I'll have what she's having.
I hope you enjoyed, and please feel free to subscribe to our YouTube channel, follow us on Instagram at Elite Aesthetics, and as always, I prescribe confidence.